hang in there. I hope I can teach you something. So we're going to just cover 4 main things today. How common is breast cancer? What are the different types of breast cancer? How we treat breast cancer, and then some tips for prevention. And I'm happy to take any questions at the end. So as you all may know, breast cancer is very common. This is a map of the US with estimated cases for the year 2020. California is expected to get about 30,000 cases. And I will say most people in the audience probably have been affected by breast cancer, either personally or a loved one, a friend, anybody in your family. It is quite common. It affects 1 in 8 women. And it is the most common cancer that women face. Fortunately, it is not the most common cause of cancer-related death. Lung cancer is more deadly than breast cancer. And breast cancer gets a lot of money for research, so we're very spoiled in that sense that we have a lot of different ways to outsmart cancer and kill it for breast. And I'll just give my plug here that, you know, early detection is really a key to surviving the disease. The number 3 most common cancer and the number 3 most common cause of cancer death is colon and rectal cancer. So if any of you have not had colon cancer screening, I encourage you to have that. That's also a way to early detect cancer, just like getting a mammogram for the breast. And sometimes too, it can be preventative in removing polyps. And so I will go to my next slide where we're going to talk about the different types of breast cancer. So the breasts were anatomically made for breastfeeding. And so when someone gets a breast cancer, it's usually of the milk gland, which makes milk for breastfeeding, or in the milk duct, which are little tubes that connect the milk gland to the nipple. Most breast cancers, almost 80%, are of the milk duct. And those can either be a cancer that invades outside of the milk duct, called an invasive cancer, and sometimes we catch it when it's still inside of the duct. And this is a pre-cancer, stage 0. That's called ductal carcinoma in situ. Some cancers are a little bit of both, and there's a few rare type of tumors that can occur of other types of breast tissue. But this is the overview of the main 2 types. The most important part about when somebody gets the diagnosis of breast cancer is not if their cancer came from the milk gland or the milk duct. It is what their cancer likes or what it doesn't like. And these are called biomarkers, hormone receptors. There's all these different names for them. But basically, we know on breast cancer cells, there will be receptors for estrogen, progesterone, which are female hormones, and this other funny thing called HER2/neu. And some cancers love estrogen and progesterone and don't like HER2/neu. Some cancers don't like anything. And this receptor status is actually the most important part of somebody's breast cancer diagnosis. And so this is kind of just an overview. I realize it's a little bit blurry, but most cancers love estrogen and progesterone and do not like HER2. Thankfully, since this is most of breast cancers, these are also the cancers that have the best prognosis. And the reason is because they're easier to treat and they're usually more slow growing cancers. So commonly, if someone has a cancer that likes estrogen, we have pills we can give them that blocks estrogen that decreases the chance of it coming back. Cancers that are a little bit tougher to treat are called triple negative. So that means the cancer doesn't like estrogen, doesn't like progesterone, and doesn't like HER2/neu. And these are a little bit trickier to treat. And then some cancers like this special thing called HER2/neu. And we actually have a great antibody medicine for that. So it used to carry a more aggressive cancer diagnosis and a little bit worse prognosis. But now we have these amazing drugs and it's not as scary as it was. The way that breast cancer is staged, a lot of people, when they find out they have cancer or they know somebody has cancer, they want to know what their stage is. And for most cancers, the way that we stage it is how big is the tumor? Is there any involvement of the lymph nodes? And has it spread to anywhere in the body? So that's called TNM staging, and that's what we do pretty standard. But for breast, it got a little bit more complicated, January 2018. We also take into account what's the grade of the tumor and these hormone receptors. That's how important they are, because someone could have, let's just say, a 3-centimeter tumor that loves estrogen, they have a different prognosis than someone with a 3-centimeter tumor that's triple negative. So we take that into account into the staging system so that they're staged more appropriately for their prognosis. And then one other very cool thing we have for breast is this newer test called an Oncotype DX, which we often order on our estrogen positive breast cancer. And the thing that is so wonderful about this test is it tells us the chance of cancer coming back based on mutations in the tumor. And then based on that, it helps us decide if someone needs chemo or not. So I'll just give the example of like 30 years ago, this test didn't exist. And everybody with invasive cancer got chemo, but we knew that there were certain women that didn't need chemotherapy, but we didn't know how to tell who needed it and who didn't. So that just everyone got chemo. And so then they went back and studied lots and lots of tumors and figured out certain mutations in the tumor that predict the chance of cancer coming back. And if there's a lot of mutations and it's a high chance, then somebody needs to have chemotherapy. But if it's a really low chance, then we can completely forego chemotherapy and all of the side effects because we know it's not going to benefit someone. So this is a really fabulous test, and I love ordering it for patients that are a candidate and finding out that they don't have to have chemotherapy. The way that we treat breast cancer. So we talked about breast cancer is common 1 in 8. We talked about the different types of breast cancer and how intimately tied it is to these hormone markers. How do we treat breast cancer? In general, it's 3 people. It's a radiation doctor, it's a breast surgeon, and it's a medical oncologist. And the breast surgeon and the radiation doctor treat the breast locally, so treating the breast and the lymph nodes, whereas the medical oncology doctor treats the whole body. And they have a lot of tools in their toolbox to treat cancer, and it's driven by these hormone receptors, but they can give chemo. Sometimes we give chemo before surgery, sometimes we give chemo after surgery. They can give an anti-hormone pill. They can give a medication that blocks those HER2-driven cancers. Bone medicine, new things are immunotherapy and clinical trials. What I do is surgery, and I'll go into that. This is my ode to what the journey that women go through when they get diagnosed with cancer. Usually they have an abnormal screening mammogram. They get called back for diagnostic imaging. They get a biopsy. They see me, we get a surgery date, they finally get their pathology. If they're a candidate to get Oncotype, which most cancers are estrogen driven, then we get that. Then they get radiation and they go on an anti-hormone pill. So it is quite the journey to become a survivor of breast cancer. And I am in awe of all my patients as they go through this journey. What I do is breast surgery. So I either remove part of a breast for a cancer. In general, this is paired with radiation to reduce the chance of cancer coming back. Or sometimes we remove the whole breast. And sometimes even if someone removes the whole breast, they also have to have radiation. We can sometimes do mastectomies where we save some of the skin and the nipple, and then somebody can get immediate reconstruction. The survival is the same. So if women have a choice oftentimes for smaller tumors where they can decide if they want to remove part of their breast, if they want to remove their whole breast. So these are all options. The other surgery that I do is lymph node surgery. So we often find the first lymph nodes that drain the breast and see if they have cancer in them or not. And sometimes we have to remove more. In the past, they were more surgically aggressive with removing lymph nodes, and now we've become a little bit more judicious about how many lymph nodes we remove because we're trying to avoid a side effect of lymph node surgery called lymphedema, where the lymphatics that drain the arm are also removed with the breast cancer surgery, and then the arm struggles to drain. So a lot of breast cancer is trying to not overtreat women and trying to do whatever we can to get them cancer free without causing harmful side effects of our cancer treatment. I'll move now into the preventative tips. This is just kind of an overview. People that have a family history of breast cancer are going to be a little bit elevated for a risk. Eating fruits and vegetables every day, limiting processed and red meats, getting your screening. And I'll go into a little bit more about weight, activity, and alcohol. And then City of Hope loves superfoods high in antioxidants. So why is exercise and weight loss important? So before I talk about this, I just want to say the most common cause of death in women is actually heart disease. So everything I'm going to talk about that's helpful for reducing the risk of breast cancer is also really beneficial to the heart. So exercise and weight loss benefits breast cancer because for whatever reason, when women have excess body weight, the actual fat in the body makes more estrogen. And since so many cancers love estrogen, it increases the risk of breast cancer. There's also some interplay with insulin levels. So losing weight when you're postmenopausal, or at least staying the same weight and doing some form of increased physical activity, actually really does reduce the breast cancer risk. Alcohol use. So the less amount, you don't have to never drink, but ideally less than 1 drink a day for 3 days a week will have a lower risk of breast cancer than somebody who drinks every day. And we can probably attribute 2% of breast cancers, believe it or not, to alcohol use. And in countries that drink more, like Italy, they have a maybe up to 8% risk of breast cancer just from the alcohol use. And this likely has to do also with this estrogen interplay of increasing estrogen levels in our body, and then that feeding these cancers that love estrogen. So it's hard to say that there's, true evidence if you eat fruits and vegetables, you're going to have for sure a lower risk of breast cancer, but it's hard to study because we can't control people's diets 100% and study them. But I am a huge believer that the more fruits and vegetables we eat, that provides protection against cancer, and limiting processed meat and processed foods. There are trials that are actually looking at vitamin D to see if that actually can reduce the risk of breast cancer, as well as aspirin. And with aspirin, they think it might act like a weak estrogen blocker in the blood and maybe decrease the risk of cancer. So we have a trial open at City of Hope where women who have had a high risk breast cancer are randomized to get aspirin, and we see if that reduces the risk of breast cancer from coming back. Soy is a popular question. A lot of women are afraid once they get breast cancer to have soy, because soy also contains these phytoestrogens, which are really similar to human estrogen. And it makes sense if you know you have a cancer that loves estrogen and you don't want to feed it, that you wouldn't want to eat any products that contain estrogen. But really, it's been well studied. Soy is completely safe to eat. I am vegetarian. I have soybeans all the time and tofu. There was a study of more than 73,000 patients in China. And actually, the more soy somebody ate, they were less likely to develop breast cancer than women who ate less soy. So again, I truly believe that nothing in fruits and vegetables can really be harmful to you compared to any of the other food groups and processed meat and processed things. Early detection, mammograms are still the gold standard. If you have not gotten a mammogram, get one. If you have family members, we just finished October, our pink month, but it's a great time to just remember other people in your life and ask them. My mom got diagnosed with breast cancer purely because her friend urged her to get it. She just had skipped it, and her friend told her to go do it that had breast cancer, and that's how they found it. I pretty much recommend getting a mammogram every year. Some women can fall into a group where you can switch to every other year once you've had a lot of really normal mammograms. But I'm in a biased group where I see a lot of women with cancer. And so I'm a fan of screening regularly. And when to stop, continue as long as your health is good and your life expectancy is good. If they find something and you're not going to get treatment for it, then definitely, I don't think it's appropriate to be aggressive with screening. But if you want to have, cancer found early, I think it's great to keep getting mammograms. So we talked about how common breast cancer is, 1 in 8. Different types of breast cancer, ductal versus milk gland, but really the thing that matters most is if the cancer likes estrogen, progesterone, and this thing called HER2/neu. We treat breast cancer locally, which is me and a radiation doctor, where we remove the tumor and sometimes give radiation, and then medical oncologist gives treatments to the whole body. And then we talked about some of my tips for prevention, which are all things that also benefit your heart: eating fruits and vegetables, exercise, exercise and maintaining a close to ideal body weight.